let's also look at treatment of diabetics who have a high incidence of peripheral neuropathies and vascular disease, and treatment with efinaconazole. And this was a small study by SHOFLER and colleagues published in the Journal of Clinical Podiatric Medicine and Surgery in 2020. They looked at 40 patients with onychomycosis, and the average hemoglobin A1C level was 7.71. And they found that the complete cure was 11%, and the mycological cure was high at 58.33%. And these are examples of patients in the study where you can see what they look like initially and what they look like after full treatment. And they found that the glycemic control, it didn't matter about the glycemic control, there was the same outcome in these patients, and the drug was well tolerated. So even in diabetics, where it's thought to be a poor prognostic factor, efinaconazole certainly can be considered as one option. So this was a better study. This was a larger study, and it's also placebo. And this was a study by Tracy Valhovic and Warren Joseph, published in the JDD in 2014. And so this was a post hoc analysis. So this wasn't the original trial endpoints, but they studied a small subset of patients after the phase 3 trials. And there were 112 patients, age ranged 29 to 70 years. Patients were treated for 48 weeks like the original clinical trials. They then looked at the patients at 52 weeks. Patients were randomized either to efinaconazole solution or placebo. And the mycological cure with efinaconazole in the diabetics versus the non-diabetics was basically the same. And the complete cure looked like it was a little lower in the diabetics versus the non-diabetics, but the difference was not statistically significant. So again, a study showing that efinaconazole can be used in the appropriate patients with diabetics.